My talk today is about killer viruses, and I've subtitled it The How and the Why because I'm really trying to get people to not be surprised that we keep seeing viral outbreaks all over the world that impact the world and have major implications for societal and healthcare disruption. So through this talk, I'm going to try and draw out what are the characteristics of our race as the human species that brings these things to the forefront. Why do these things keep happening? Why will they keep happening? And what underlies them? So I'm going to use several different case examples trying to show the principles and the fundamentals of what this field is about and why emerging infectious diseases will continue to surprise us and be endlessly fascinating. The biggest thing I always do is give this example that Louis Pasteur, one of the very famous infectious disease luminaries from history, always said, chance favors the prepared mind. So the more people know about this, the less likely they are to be surprised. So when you're counseling a patient when they're traveling to Africa, or when they're traveling even to Europe, or when they come back and they have an interesting disease or something that you can't figure out, the fact that you've heard it once and you've primed yourself to think about these types of possibilities makes you more likely not to miss it. We saw what happened with Ebola in Dallas, where you had a missed case and then a cascading effect that threw the country into calamity. That's because someone didn't ask travel history. So the biggest takeaway I can say is that you have to be cognizant of these illnesses, no matter how rare they are, because the world is a very, very small place, and that's one of the themes of my talk, that someone can get from one side of the world to the next side of the world very, very fast, and something that's a problem in Africa can be a problem in Pittsburgh the next day.